Welcome to our 7th of 11 webinars in our 2024 Women in Leadership Executive Speaker Series, with this one specifically focused on women leaders in healthcare. I'm Dr. Susan Madsen, founding director of the Utah Women in Leadership Project, and also the Karen Haight Huntsman, endowed professor of leadership in the John M. Huntsman School of Business at Utah State University. And I'm the host and will be the panel moderator today. And this event furthers the mission of the Utah Women in Leadership Project, which is to strengthen the impact of Utah girls and women. And we serve Utah and its residents really in 3 ways. First, we produce relevant, trustworthy, and applicable research. Second, creating and gathering valuable resources. And third, convening trainings and events that inform, inspire, and ignite growth and change for Utahns. So I'd like to thank our sponsors, UEN, which is the Utah Education Network, the John M. Huntsman School of Business, and USU Extension. So I'm just going to jump right in and introduce my 2 guests. Thank you for being panelists today. Let's start by introducing Dr. Donna Milavetz, Chief Medical Officer for Regence BlueCross BlueShield, and she brings more than 25 years of clinical experience and business leadership in value-based care, quality improvement, and preventative medicine. And she joined the leadership team at Regence BlueCross BlueShield's regional health plans in February 2022. So prior to that, she also served in vice president roles at Steward Healthcare. She founded and led On-Site Care Incorporated. And Donna, I think that's when you and I met a while back. And she was the chief executive officer and chief medical officer for more than a decade. And Dr. Milavetz is a distinguished community leader, passionate about improving women's health specifically, but health in general, and has launched programs including the Women's Heart Clinic at the Mayo Clinic. She is a volunteer physician and currently sits on the board of Jewish Family Services and serves as chair of the Board of Governors for the Salt Lake Chamber of Commerce. She also received her doctorate of medicine from the University of Arizona College of Medicine and a master's of public health from the University of Minnesota's School of Public Health. I did not know you were a co-University of Minnesota. I got my doctorate there. So Donna, welcome. Thanks for joining us today.
Thanks for having me, Susan.
And Dr. Gina Hawley was named Chief Operating Officer for the University of Utah Health Hospitals and Clinics. And not that long ago, it was January 3rd, 2023. And Gina has a robust academic health system experience from her previous roles at Oregon Health and Science University. Oh, I just remembered that. That's why someone over there is joining. Johns Hopkins Medicine and other institutions. And she started her career in healthcare as a nursing assistant, increasing her passion and dedication as she took on more responsibility and leadership. Her most recent position at the Oregon Health System was serving as Vice President of Professional and Support Services. And in that role, she oversaw 14 allied health clinical program and service lines, central services, and support service departments. Dr. Hawley holds a bachelor's degree in health administration and policy from, is it Creighton University, a master's of healthcare administration degree from the University of Minnesota, there you go, yes. Carlson School of Management, and a doctorate of public health degree from Johns Hopkins University, Bloomberg School of Public Health. Wow, we all have a connection in Minnesota. I did not know that. Gina, welcome.
Good. Thank you for having me.
So it's great to have you both. And now I want to start first. Donna, I'll have you start. I'm going by first names. Please call me Susan. We'll just go with the first names today. But let's have you both start by giving us some background about your career path. I've read your bios, but give us a little bit more. How did you get to where you are now? So Donna, let's start with you.
Yeah, so I would say, bottom line on top, a circuitous route. I started, my parents were both very ill when I was young and very impressionable. So my idea was that I would become a doctor and I would help others so that they wouldn't feel as hopeless and helpless as I felt as a kid. So that was my driving force to go into medicine. I absolutely loved internal medicine. So for me, I really love the whole idea of treating the whole person. I still do. And thought my career would be just that, treating the whole person and being a general internist, recognizing that there wasn't at the time when I started in medicine, not a lot of research on women, that taking the lead in women's health and leading that strategy in terms of just helping other emerging physicians learn more about women's health was really my goal at the time. When I finished my residency and started in my first job as junior faculty, I was asked to actually start a women's health pathway for a residency program. So that's really when my leadership journey began. And I think I was voluntold at the time, but didn't know it and saw it as an opportunity. But that's where my journey began. And throughout my career, in sort of moving to different positions, again, was naturally sort of asked to do more, and I just kept saying yes. When we moved to Utah and I started working for Intermountain Healthcare, started an interdisciplinary women's health center, I rapidly learned that you needed to understand the business side of healthcare, and having picked up my MPH along the way, really believed in this whole idea of population health, which I'm still very deeply passionate about, even in my role today. But really thought that, oh my gosh, the healthcare system is really kind of broken. And I naively thought that, wow, like maybe I could do something about that. I believe in the power of one. So I quit my job and I started a small healthcare company called On-Site Care, which you alluded to, which put primary care clinics on the campuses of large employer groups. And the premise for me was that I would take a closed population, an employer group, and really see if engaging in dealing with the two issues of access to care and cost of care. We did care right at the location and we made it no cost. That hypothesis would pan out to improve long-term health outcomes and decrease total medical expense. And I had an exceptional CEO, women leader, who took a bet on me and started the company. And we were very successful. I had the privilege of scaling the company to 4 states before I had a financial exit to a strategic buyer, which again, if you had asked me if I was an entrepreneur when I started medical school, I would say absolutely not. I say all the time that I was a reluctant CEO, but I learned a lot and understood the business side of medicine. I then, in my most recent career move, had the opportunity to move to the health insurance side. And that was the one aspect of care for the health delivery that I didn't actually understand. So I had the opportunity of once again reinventing myself. I had no health plan experience, so Regence took a bet on me to join their organization. And I will say it's been Mr. Toad's wild ride to kind of Disney World or Disneyland ride. And it's been fantastic. And I think as the leader of the organization and as the chief medical officer and shaping policy, using all of the skills that I had in my back pocket from all of my life experience has led me to this point to do what I'm doing now, which is really leading from a clinical perspective, the organization. So that's my circuitous route.
I love it. And I love that you're so interested in your organization, what your organization is doing, but in the larger work within Utah and beyond, and really engaged with the Boulder Way Forward as well. And which I love, which is focused on really shifting things for girls and women, which then impact men in positive ways too, right? So thank you for being such a strong advocate of girls and women and particularly here in the state of Utah.
My pleasure, my privilege.
Oh, thank you. And Gina, same question over to you. So you're pretty new to Utah, and you and I met, I think maybe a year ago or something. I can't remember how long ago. And you were like all in. Let's work on this. So introduce yourself, your career path.
Yeah, no, thank you, Susan, and thank you, Donna, for your great intro. I'm a little embarrassed to say a little bit my path, right? So Susan did such a lovely intro that I'll just give some snippets. But I was pre-med when I was younger. My father was a physician, and in my culture, being a physician is, working in healthcare is one of those things that is like that's what I was aiming for. And I have to tell you, embarrassingly enough, I was getting C's in biology and organic chemistry and miserable at college. Like I just couldn't hack it. And we joke, actually, there's a joke in for administrators that a lot of us were pre-health and just realized somewhere along the way that's like we may be in the wrong profession here. But I was lucky, and actually goes back to women's health and everything, that I was a nursing assistant for high-risk OB and labor delivery. And that's where I started off in that journey. And when I was trying to do the pre-med route, I noticed what my nurse manager was doing, and I was lucky enough, Creighton had a health administration and policy undergrad. So I decided to just go that route. Thinking also, right, it's interesting how the journey takes you. I thought I would stay in community health systems. As Susan alluded to, I've been in active medical centers most of my career. But after grad school in Minnesota, I worked in a community health system. I loved it. I was a clinic manager. And my significant other, who does the same thing I do, which makes for very boring dinner conversations, but he got a job out in Baltimore, and he was at Hopkins, and I was actually looking just for a job. And I ended up at Hopkins, and I was so like confused, right, at active medical center, because you just don't have the patient care, but you have the research and the education. And that was a learning curve for me, but I ended up loving it because of the innovation, right? Because of you get almost so, and this is, everyone's different. I still love community health system. Patient care is near and dear to my heart. But it was just such a neat field, and it's just amazing what happens when the opportunities start to come up. You just have to know if you want to take it or not, right? And maybe just take a jump. And so I ended up I was in Baltimore. I'm originally from Omaha, Nebraska, spent a couple of years in Minnesota, 9 years in Baltimore, 8 years in Portland, and now here for the last year. And just have loved the
And
journey.
stay with us. Can I just say,
Oh,
stay
thank
here
you. I
forever.
appreciate you. No, it's been a lovely ride. The people here have been amazing. Different cultures, right? And that's where I think, Susan, when you and I met, Susan and I were also talking sort of love of teaching and education and really root cause, and this just seemed like such an honor to be with the Boulder Way Forward and so forth. So that's a little about me. Donna, population health is near and dear to my heart, and really how it lands with our communities and our different populations is just so important to me. And I teach part-time on some of these topics, and
Oh, good.
it all brings it all together in a nice way. So that's just a little bit about me.
I love that. And if I'm remembering right, you have a couple little kids too, right?
I do. We have a 6-year-old and 9-year-old. If you can't tell, this is
That's right.
this is my ability to have them stop fighting in true transparency as I do competitions with who draws better artwork. And that's usually around 9 o'clock at night when we're trying to get them to bed. But yeah, 6-year-old and 9-year-old, and my husband and I, we've been lucky, right, to move to great places, and it's no different here.
Oh, and the reason I bring that up is I was just thinking, people that listen in, that whole work life, work family is often tricky, and it's trickier often for women, most often, I would say, for women than men. But if women have such a leadership career, oftentimes you do have a good partner. that supports each other, right?
Oh, absolutely. And, Donna, I don't know about you and your journey, but and I think this is why it's so important to really focus on women and girls thriving here, is that I think all the time of the luck and privilege I had to have a good support system. To that point, we came here cold, we didn't have family and so forth. And that's unique to Utah, right? In full transparency, it's different. But if I couldn't be without my support system, my family, my husband, and so forth. But a lot of people don't have that. And so the question is, how do we create that system and structure to make it easier for women and for girls, wherever they want to be, that they have that support to make that decision?
Yeah, any comments about that, Donna?
Yeah, no, absolutely. So I'm a mother of three, and I echo everything, Gina, that you're saying, and would say that I also came to Utah without any family support. Our family lived other places. So what I would say to people on this call, for anyone that's listening, it takes a village. And that village may look different for different people. It may be family, it may be hired help, it may be friends, it may be neighbors, it may be someone at the school, but it does take a community. It's funny that the saying is, behind every successful man is a woman. Well, behind every successful woman is a village. And I absolutely believe that. And what I think is important for me to model to others, specifically other women, is that it's okay to ask for help, and it's okay to ask for the village. And having somebody, I had the privilege of having, a working husband that we could support, having someone come in the home and help our kids. But childcare is a really big issue. Making sure that there's good nutrition on the table, if you will, is sometimes really challenging. So tips and tricks to help, forming a kind of the food for the neighbors. Like, that's what I did. It was like, okay, you make this meal for 9 people tonight, and I'll make it tomorrow night.
Oh, really?
And doing creative things like that sort of helps share the burden. So that's really important to make sure that we message that. And then, as a corollary to that, is to have other women not bring us down for that. I will say that sometimes we are our own worst enemies, and saying, oh, well, I noticed that you didn't make it to your kids, whatever, and, fill in the box. And I'm like, yeah, I unfortunately, I had to see patients that day, but guess what? My neighbor went and they filmed it for me, and I watched it, and it was awesome. So, like, there's other ways to do that. But I think the more we break down those barriers and that stigma, I think the better we are.
Thank you for that. I think the women supporting each other, I think we're seeing that start to turn, although I still think it's there naturally. In fact, I know the research behind it. We won't talk about that. But I think when people are conscious, more women are supporting each other. And we see that in a lot of places. But we still see, unfortunately, some women in power that are not supportive of each other. And it's so fascinating. Gina, any thoughts about, we're already off our track of questions.
No, it's okay.
I love the conversation so far.
Me too. No, I was just thinking, it's like Donna and you both were talking. I was like, oh, I have maybe tidbits or example there. I think it's up to us to really break down the historical context, right? Of how maybe us as women in leadership positions or otherwise have been. And part of this is, you look back when, when you really digged and to understand folks, they're like, well, yeah, I had to do this because that's how it was. I was in a male dominated field, right? Donna, as a physician, you know this very well. And you see this in other areas, and you're like, okay, I could get that. However, Susan, to your point, times have changed. And I think there's a patience and a grace that we have to give each other that is really important, right? There was the previous CEO of Coca-Cola used a glass ball analogy, right? That there are going to be things, it's hard to do everything, right? I think, Susan, we're talking about priorities, and prepping, like, can we have it all? And that support system is important, but also priorities. Like, there's going to be some things that drop, and that's okay, as long as it's not the most important things, right? You want to make your kids dance recital, but you can miss that meeting or be late to that meeting, right? Or vice, there's things that make a difference.
But we are perfectionistic as women, which is hard. You have to practice dropping things sometimes.
Yeah, and I think it's also important for us, and easier said than done, but we also we want to catch folks, right? Like you want to sort of catch if we feel, or like even help folks that they feel they're not getting the mentorship or the support that we're providing that. Like, right, we're being looked up as leaders to be that giving that support and sensitivity and empathy, because we know what it's like having gone through this. So we want to pave the way, right? And so I think that's really important to know that we all have insecurities. We all have those things that make us human, and that's okay. The question is, how do we make it better for those after us and around us, right? How do we pave that path is really important. And I think that's where these conversations and things are really help.
Well, thank you so much. So I've got many questions I'm thinking about, but both of you, and I think one of you alluded to this, but both of you have such passion around girls and women. We love our sons too, right? We love men too. But where did that passion come from? I know, Donna, back to you. Just tell us about where that passion around girls and women specifically has come from.
Yeah, so I would say, I grew up in a time and went to medical school in a time where, I was discriminated against, I was dismissed, I was discounted. And having 3 children, a son and 2 daughters, like I didn't want that to be their narrative for the future. So making sure that I stood up and hopefully creating a role model for others, I think is really important. I think as a female in medicine, as a female physician in medicine, we know that we are terribly underrepresented in healthcare. At the CEO level, there's, somewhere between 13 and 15%
one of the
of
few
women, right, are represented. And as consumers of healthcare, right, women disproportionately use more healthcare services than men, because we tend to have things like babies. And we also tend to make the healthcare decision. So if we have diversity of voice at the table, that's really, really important. So for all of those reasons, I'm really passionate on just having more inclusivity of voice at the table.
I love that. And Gina, you can answer that, but I also wanted to throw in another question, which is, what are a few things that you've done in your career that you think have given you the biggest chance to develop your leadership skills and abilities?
Yeah, no, I appreciate that. I will say, maybe answering the first part of the question, I think of for me personally, I am first generation. My parents immigrated here probably about 50 years ago, so quite a while ago. And born and raised in Omaha, Nebraska. So, right, that's that's a very unique place for my family and I to end up. That's where we ended up. And I want to tell you, I have constant thoughts of how life turns out. My father, who recently passed about a couple of years ago, was very big on, don't forget what the hard work and the dedication, everything go. There's a bit of luck, right? You had luck of how you were born, how things happened, right? And part of that is, I always think about, if I had grown up in India, not good or bad, just different, how my life could have been very different. And my parents were very big on education, and I was just in an environment that really helped me thrive. And so that's where I always think about why this is so important to me. This topic is, how do you help those who have not had that privilege, right? Have not had that luck to be here and to have those places. And so how do you help that? So that's a part that I've come from. I will say that, to your question of how it's that being said, right? All the things, I think, Donna, you're talking about, different world, when you're in sort of a little bit of these different levels, being a female, being from a diverse background, being, pick and choose, right? Like, this is just different. all around, I think one of the things that's always helped me, and maybe advice I would give is the opportunity, is that you should, as opportunities come, really try to take advantage on you. And one piece of advice, and it's actually the reason I got my doctorate, I was in Baltimore working full time, and I was across the street from the School of Public Health there. And, you know, like when you're working full time, going back to school does not sound appealing by no means. I mean, you question your life choices when you're doing it really, and multiple times. And I thought like, wow, wouldn't it, I was like, do I really need to do this? I really don't need it for what I do, right? And I had somebody tell me, who was a previous COO back at Hopkins, he said, you know, Gina, shame on you if you don't take the opportunity that's in front of you, right? That is there. And a lot of times we don't take that opportunity, so we're busy, right? And that's fine, that's understandable. But I guess what I would say is one thing that has helped me is that even if I'm known, for example, that I may not get a certain opportunity, that may not work in my favor, just to get that experience to add to my toolkit has been really helpful for me. And so that's the advice I've given a lot of folks, is that it may not work out for you, right? Like there are tons of times things have not worked out for me. I've not gotten jobs, I've not gotten positions, I've not gotten to certain programs. Like it has, you know, right, that it waves and waves, but all those experiences have made me who I am today, and has helped me. So I think you try to enjoy the journey, but really, you know, shame on you if you don't take the opportunity that something presents. Like go to educational sessions, volunteer if that fills your boat, like do different things.
And I love what you're saying, Gina. And I also love that sometimes when you take that, you just learn, you wouldn't have probably discovered your passions and what really connected with you if you would have headed down the other path. And now you've found this joy that is even stronger than a joy. You know what I mean? It's so interesting how the paths just move and your choices. I love that. So Donna, I know we could stay. I'm trying to like divide questions up, and we want to start you know, soon pulling in some questions from the audience. But I want to ask you a question that you probably saw, you know, that I smile at. And I think this is a fun question. How have you, and I'm smiling, how have you been a strong leader without alienating people or upsetting them? That's a question we would ask to women leaders, often not men. And what do you do if people are unhappy? Do you see why I'm smiling about this? Because we know if we're leaders that people are not going to be happy, but we like as women to make everybody happy. You know what I'm talking about. So what would you say?
You know, it's so interesting, you know, for the audience. I did get prepped. We both got prepped on this question. And when I read the question, Susan, I almost emailed you back. And I'm like, you know, you wouldn't be asking this of male guests. So,
I know.
so, I spent some time, I reflected on it. And I will say that even though as women, we have been conditioned in society to want to be people pleasers, I think as a leader and just as I would say an enlightened human being, so for me, I don't see this as a gender issue, is that I think in our world today, because we have so much conflict, I think the idea to be understood is really important. And I go back to a little bit of part of my medical training in psychology. So just humor me for a second, that, you know, we have our prehistoric brain, right, in the background, and then we have our prefrontal cortex, that's our reasoning center in the front. And sometimes when we get really emotional and when we're hearing things that are either unpleasant or go against what we're thinking, we tend to go back to that, as I like to call the reptilian brain of ours, and we act on emotion rather than rationalization. And having the skill to sort of have those neurons fire to get to the prefrontal cortex, where it's the reasoning center of our brains, is sometimes challenging. And so I answer your question in saying, I take a deep breath, and I do that intentionally because it just decreases the cortisol levels in one's body. And I force myself to get into my prefrontal cortex and start to say, I'm super curious of why what I've just said or what I've just did caused this person to react in the way that they did. And then I ask them about it. And it is completely disarming in the best possible way to say, hey, I'm really sensing that you are angry, or I try to name the emotion of it, that you're frustrated. Tell me more about that. And what that does is it gives the person across the table the grace to take a minute. And this mostly happens, sometimes it doesn't, but
Perfect.
to get into their prefrontal cortex and then to have that dialogue. And I find that doing that allows for a much more fruitful conversation. And we find out typically that there's an underlying etiology that maybe either one of us didn't have all of the information necessary. And then we are quickly able to get to a consensus. And that's like conflict resolution. But
Yeah,
I feel like that's the life skill that everyone needs to learn. And it's not gender specific. I think that we just as women frequently, not universally, but frequently, we tend to apologize instead of leaning into understanding root cause. When I'm gonna put this out there for the group, and then I promise Susan, I'll stop, is we tend to say sorry when we bump into someone, we're like, oh, sorry, instead of excuse me, or oh, I'm sorry. When we really didn't mean we're sorry, we really meant excuse me, or that didn't make sense, or fill in the blank. So I want to encourage the people on this call, and to be fair, for most people that I talk to, is let's start thinking with, and I use my little finger,
Yeah.
which is sort of weird, but I say, like, let's get into our prefrontal cortex and let's discuss this.
Oh, that is so awesome. Gina, did you want to add anything to that?
No, I love that. I absolutely love it. And now I'm like thinking about it differently, actually. I thought the same when I got that question. I was like, oh, that's interesting.
It is.
It is. I have and I totally agree with Donna. It's something that's very innate to women, especially. It could be depending on where you are from the region and things of that nature, but the sorry part, right? Is like it's instantly happens. And it's like, how do we step back? But I think more under that is uh it's how we listen. It is, and it's sometimes it takes more time, I'll have to be honest, but my strategy has been listening to all viewpoints. Because then when you make a decision, we all make very hard decisions at a time. They may not like the decision, they may be very upset by the decision, but at least they understood that there was a time that we listened, or we got the viewpoint on it, and or they're saying the context, right? This is why I'm making the decision. So for me personally, that listening piece has been so important, and then the emotional intelligence of reading people, which Donna, I think that's where part of that's where I gain to is all those together has really helped me. I will note that sometimes it is not about you, right? It's not about you. I have a quote on my desk that is a Mother Teresa quote. Like, sometimes people think you're unreasonable and kind, let them think that. Sometimes they'll accuse you not being honest, be honest, right? Because at the end, you're trying to do the right thing. You're trying to do what's right. And I think part of this, sometimes if you could, easier said than done, but over time, I have really had to be like, instead of being very like, why are they upset and things of that nature, take a step back and say, you know what, it may not just be about me. Or if it is, it's okay. It's okay. As long as you feel you did right as best possible, that has helped me sleep better at night.
I love
Honestly,
that.
in my career.
I love that. Thank you so much. And one thing I'm going to just point this out because all three of us have done this in this call. We are so socialized and to say, I'm so lucky, I'm fortunate, I'm so blessed. Men don't usually do that as much. So I'm just kind of throwing that all three of us have done that today, which is a socialization, which I don't think is, well, on one hand, it's maybe not bad or good, but on the other hand, we make our way. You too have had done so much education. You have been, leaders that we're not always lucky. Anyway, I just wanted to put an observation out there. So
Susan,
Donna, go
can
ahead.
I touch on that for just a second?
Yeah.
Because I will say that as we think about mindfulness, right, I spend a lot of time in medicine thinking about our behavioral health crisis and whole person health. And this idea of gratitude, I think, is really important. It centers me, it decreases cortisol levels. And so for me, I think of it as, boy, there's that positive mind speak in the back of one's head also is really this idea of there's a lot of people in this world who could have it a whole lot worse. This is why I am grateful in the moment for what it is. And so I think of it a little bit differently, but I think that it's an evolved way of thinking.
Oh, I love it. So I have two questions. I'm going from people listening in that I've been going back and forth. Which one do I do first? But I'm going to start with one on mentoring and coaching. Do you see that in the chat? I don't know. Okay. How are each of you mentoring and coaching other women? And I think this is a good question because I think we all need to be aware of that, right? How do we, and women don't just need women coaches, but women struggle with things that are unique to gender too. So who wants to dive in? Gina, do you want to take that one first?
So it's a good question. I've always had a really thinking about now I have to try to be careful about saying luck, but like I've had great mentors,
Yeah.
right? Yeah, no, it's a fair piece of it, right? There is part of this is we talk about the previous generation of like how do we build women up, and then now is it a pendulum swing, right, that we're figuring out, but now I'm thinking through that. But I think for me, I have had some really great mentors, both women and men, all different backgrounds, and actually I'm even part of a mentorship program where I'm the mentee, which is super cool. Yeah, so we're doing here at UHealth, we're doing a mentee program with given the work that we're partnering with out in West Valley. So really with the community that I'm the mentee. And I think I will tell you that one piece of how I've mentored is really one sort of open door policy of people who would like to connect, regardless of what business or what role you're in. Being able to be open of where they're at is, I think, something really important, and doing both informally and formally, right? Um there's formal mentorship, but then there's informal where you meet someone, right, just naturally through these sessions or somewhere else that you just start grabbing coffee with, and sort of opening up, and then noting that every individual is different. So really, how do you gut check yourself that you're not offering the same things over and over, right? That you're meeting that individual where they're at in their space has been something that I'm not always good at, but I'm just always trying to think about. So those are some of the things that when I think about me mentoring or I'm being mentored, it's really how you meet them where they are.
I love that. Donna, any thoughts there? But also I want to just what are some strategies also to have us as women leaders lift other women? I mean, even small things, right? I know in my experience, I do sometimes it's just a small thing in a meeting that can help raise awareness of another woman. So thoughts, Donna?
Yeah, so echoing, Gina's thoughts in terms of, I've been mentored, I am a mentee, but it is specifically sort of getting around to sort of your question. I think for me, empowering women has been a lifelong journey for me, and it is something that I make a priority in my life because it's important to me. And it goes back to sort of our original thought or opening comments, like prioritize what's important to you. And so that's important to me. So I really try to make time and create space to be able to have those informal as well as formal conversations. I think that
you're making space.
absolutely, you
yeah.
have to do that. And it doesn't, like, I don't I have one specific codified mentor right now that I'm mentoring. But there's a lot of like people will say, hey, can I have 10 minutes of your time? Or can we schedule a 30-minute Zoom session for me to just do a meet and greet? And those are really helpful, I think, to whoever's reaching out. So I try to make a point to if anyone's reaching out to me, to at least give them, 30 minutes or an hour. I'm pretty sure I can carve that out in my work week within a 4-week period of time, right, to do that. Second thing is that within the moment, I think recognizing people, especially people who are at, the level sort of below where I'm at, to say like, hey, this was the work of so-and-so who did this. And a big shout out to that person, I think goes a really long way. Because I think that amplification of others sort of coming along behind me is really, really important to do. I also will intentionally sort of skip level and sort of voluntold people to do stuff like, hey, I think this is a really great project for you to do. And why don't you like lean into this? And I'm happy to be a support for you along the way. So I tend to nudge people a little bit along the way as well.
Those are powerful. I've studied those nudges or taps on the shoulder for years in different studies. And I'm telling you, just the moments, even 10 seconds of something could change the way people think of themselves or their opportunities. Gina, you had a comment. I could see you unmute.
Oh yeah, no, Donna said something that was so like, oh yeah, it's so telling. It's right, the tap on the shoulder, just looking really the skip level. And are you, the rising stars, those shining stars are maybe, just are we tapping potentials on our teams? And I will say that part of it too is that this is why representation matters. Is also looking around you, whether it's your team or not, or different areas, is that's why it's really important to the mentorship is to really raise women and others up. If you really feel that you're not hearing all sides of the story, right? This is why this conversation is important, because we represent something different, a new mindset, right? Donna, you mentioned about women caregivers, right? A lot of us are, have kids or not, have older parents, right? We're part of the sandwich generation. And so we have different viewpoints that I think is really important. So that's why I just wanted to say, because Donna's comment was so like, oh yeah, that's just so important to note.
Thank you. And Gina, I'll ask you a quick follow-up too.
Yeah.
There's a question in the Q&A about, women, we are more perfectionistic. We don't like to make mistakes, but we know from the research that when we're open to making mistakes, we actually have more chance to succeed in some weird ways, and it affects our confidence, because we can succeed more if we're open to failing more. It's a weird cycle. But the question is, you've obviously made mistakes. How do you handle that? How do you get used to being okay with not being perfect? So any comments about that?
Oh yeah, I think it's actually one of my favorite interview questions to ask people is, when have you failed? And really like meaty response, right? Because we are all a lot of us in this field are very type A. And so for even us to talk about that is a little bit like, oh gosh, like really, we're gonna ask about this. I think a couple of things. One is there's a journey you go through when you fail, especially if it's something that you missed. Like it's honest, like we all do it, it all happens. And so part of that is after you go from almost to the 7 stages of grief a little bit, but once it's like sooner or later you have to own it. And then you have to decide what you're going to do in that moment. Are you going to accept it? Are you going to try to resolve it? Are you, yeah, right? Like, what are you going to do? And it's not to say one is good versus the other, right? One time that I failed was I had a chair of a department who he and I were in major disagreements, and I was so quick to my assumption, right? I own that responsibility where I should have just taken a step back and that's where in that situation, it took me some time, but I owned it and I just moved forward. And sometimes that's not the right case, right? But I think that's where I'd say is you have to, it's okay to go through your stages of grief. You try to do it as respectfully as possible. That's my one thing, is that you have your support system, your friends, your loved ones, that internally you're going to vent to. That's okay. But try to figure out the right way to go forth with it, and what's going to make sense for you individually, and in accepting it or trying to move on, and how do you problem solve through that is what I would advise.
I love that. Donna, I'm looking at the time and I have a couple of questions. There's so many good questions in the chat, but I want to get to a few questions that I have at the end, and I want to give you both some space. My question for you, and then Gina, I'll come over to you with the same question, is what are the books, training articles, like what would you recommend? What do you think, Donna?
Yeah, so I will say that, again, I'm going to wear my hat as a physician leader, and recognizing, and maybe it's medical education has changed a little bit since I went to medical school, but we didn't really have any leadership classes in medical school. So for me, especially becoming an emerging leader and an entrepreneur, for me, a basic one was Good to Great by Peter Drucker. It was sort of just like the bread and butter business book, at least I thought.
CEOs have it on their shelf, almost all of them.
Yeah. So I go back to that. I reread it actually frequently because I'm like,
Yeah.
oh, right. Like get on the bus, get on the right seat in the bus. For those of you who know the book, I think it's just really just timeless. I also have realized that one of my areas of opportunity and growth was to really understand my team better and to understand like where their strengths were, and where my strengths are, and how do we maximize that, as well as detractors. So multipliers is another really sort of good one, and how I could sometimes be an accidental diminisher, right? That was sort of an aha moment for me. And sort of along that lines, like working genius, like where do I feel comfortable in? Where do I not feel comfortable in? And how do I spend some time space in that? I'm a big believer of Harvard Business Review. I think they're just really interesting articles that are across the spectrum. And then what I would say is, because we all have so much time in our day, I think you need to understand the local politics of what's going on, and maybe a little bit at the federal level. For me in healthcare, that's really, really important. Like what's coming down the pipeline? What do I need to understand from a policy standpoint? But I just think it just sort of gives a good flavor for like, what is important in the society in which we live, or the communities in which we live. So I would say all of that, and however you want to do that, whether or not it's a podcast, like I believe in the multitasking things of listening to a podcast while I'm exercising, because like that's all the time that I have. So those would be my recommendations.
Oh, thank you so much. Gina, same question over to you.
Yeah, no, I actually was going where Donna was going, like with the Good to Great things are the ones that are really good. But two authors I really like, and they're super easy reads, are any books by Malcolm Gladwell and Atul Gawande. I think beautiful, well-written books. And they sort of they have great stories. It's real life application. And they just write so well. And it gets to sort of what makes people tick and what makes us tick, right? And I love those. So if you're looking for a good book, Atul Gawande, I can't remember, it's probably 6 or 7 years ago, but his one on dying is amazing. So good, and just talks about the system and healthcare. So not leadership per se, but it makes you think while in your healthcare, how we've sort of assumed, right? Donna, to your point, the system is broken, but how do we change it? And I think it's just two authors I would advise. Harvard Business Review, the other article I was going to say that's one of my favorites, I still give to folks because I was given this when I was more junior career, is How to Manage Your Boss. It's a Harvard Business Review. It's been recreated a couple times, and it's one of those ones that I'm just, it's so like weird because you're like, no, my boss manages me. Like I don't manage them. And it's like, oh no, but you do, because every boss is different. It's not just your boss, but it's your team and your stakeholders and all the folks you work with. Because in healthcare, that is the honor. You get to work with so many great people. And so I love that article as well.
Thank you so much. And I just skipped a question I wanted to ask earlier, but I'm gonna just like take 30 seconds each on this. And that is the healthcare industry. I mean, that's important since I have both of you. So Donna, just briefly, because I want to get over to one more big question. Would you recommend people, like for women specifically, and healthcare has a lot of women in different areas, but not necessarily in all areas. Thoughts?
Well, I'm a little biased. I
Yes,
think
you
being a
are.
physician is the greatest profession in the world. So that's an easy yes. I would also say that there's many different areas within healthcare. And what I was somewhat myopic about when I was younger was that I had to do this one path. And I would say to anyone listening that there are many paths in healthcare, and it's really good job security because everyone at some point is going to get ill in their life. And we want to work on health and prevention, but we also need to treat people when they're sick and vulnerable. So I think it's a great profession, and however you get into it, whether or not it's on the business side or on the care delivery side, the world is your oyster in many, many levels.
Thank you. Same question for you, Gina.
Yeah, I actually, I think, sorry, I'm just trying to, I think I agree with Donna on the train of thought. I, um, sorry, something just popped up, and so I'm like speaking and multitasking. Something just popped on my computer. I apologize. Repeat the question for me, actually, just to make sure. I apologize. I thought I turned off everything, and it didn't turn off. So
You are just fine. So the question, just would you recommend women come into the profession of healthcare?
yes, I actually would, because in healthcare, and I apologize, but I'm sorry. But in healthcare, it is one of these things that so many folks are, it's actually, I think, better than other industries, honestly. Now, to your point, it's not, it's in different levels, it's not as woman heavy. But when you think about different roles, right? Physicians, I think, that is increasing. Nurses, other groups, you see a big, heavily therapy, social workers. There's a really good component of women leadership, and I think it's a lot when you're in a leadership role and you've been in some type of patient care and things that nature. I think it really helps. So yeah, I think it's a great role. And I actually think it's a great industry comparatively, and this is my bias, right? So now I'm talking about my bias, is that like when you think about something that's really more male dominated, I actually think it's easier to break in healthcare because there's that realm and that yeah, the warmth, right? And I think when you think about that from a woman, again, caregiver who make a lot of healthcare decisions, I feel it's a natural fit.
Great. And my last question, always want to get to this one, is both of you are associated and know about the Boulder Way Forward, which I mentioned before, a 7-year societal change movement to really ensure that more Utah girls and women thrive in any setting. So my last question to you is, and we just have a couple minutes, what do you think are two of the most important things that need to be done in Utah to make that happen? Let's go to Gina and end with Donna.
Yeah, I think one is, and Susan, we talked about this. We were talking about when we first started about our executive committee. And how do we give opportunities to women and girls to make decisions of their choices, right? What they want to focus on. And so I think part of that is creating the system here in Utah of how we give the opportunity, right? Whether they want to work or go to school or do different things or be with family and have kids or not, or travel the world, anything they want to do. How do we create that? And I think that's where the Boulder Way Forward with the goals and initiatives and this spoke on with the 18 groups is so amazing, because I think it's going to get to the systematic causes. How do we create that structure? So that's I'm not sure if it's two things, but that's one thing that I would say. And the second thing is representation, right? Again, I'll get back to the representation piece, is that I think there's an opportunity here that I think we could change. But it's how do we get the representation where you are getting that viewpoint that may have been missed in the past. And so I think that's where I'm super excited about the initiative and the Boulder Way Forward, because I think we have the right people to really make that change.
And it's the right time. And it's, I think
Yeah.
we can really shine in Utah. Donna, profound words to end us with today.
I think sort of two things. Number one, raising awareness. It would be sort of my definition of success if no matter where I went in the state, whether or not it was along the Wasatch Front, a rural or even a frontier area, that I could go and have a conversation and people would understand and know what a Boulder Way Forward was about. So I think that's the first thing, because I think, to your point, Susan, I think that's how social movements happen and are successful. And then the second piece, as a fast follow, as having been an entrepreneur, is really, what is the 30-second elevator pitch? Because I think like having that down and having everyone who's involved with it know that elevator pitch
Yes.
and amplify that elevator pitch, I think that's I would define as success.
Thank you so much to both of you. I so appreciate your comments and your time joining us today. Thank you for all of you listening in today as well. I'd like to thank our sponsors one more time, especially the Utah Education Network, UEN. So thanks again to our panelists and everyone else. And it's been lovely to join with all of you today. Thank you. Have a good rest of your day.